I've been working as a community health nurse for a few months now. I came up originally as a senior nursing student doing my last clinical placement. So I was up for a couple months in the winter, and then I came back as a registered nurse a few months ago.
I've been practicing in First Nations and Inuit Health for 22 years. I practiced as a community health nurse for the first 2 years, and then after that I became the nurse in charge, so I was the manager.
I learned to incorporate traditional as well as Western medicine in my practice, gaining a great deal of respect for First Nations and the people in the community.
One of the reasons I stayed in this role is the diversity of your day-to-day work, as well as your diversity in the role in the community. Day to day, you can see patients who are chronic care, prenatal care, pediatrics, immunizations. You do triaging and emergencies, so it's ever-changing and requires a fast-paced, and I really enjoy that.
Your whole day is focused on whatever walks in the door and what emergencies you have to deal with, or working in clinic, drawing blood. It's only as limited as what the needs of the community are.
Professionally, a challenge with working in a remote First Nations community would be the lack of modern equipment that hospitals have, as well as diagnostic testing and stuff like that, or specialists who patients need to see.
Nurses are always on call during the night for emergency services. Some of those can be rather lengthy emergencies, even going as far as 3 days, for example, if the weather is out and we can't get a patient out.
Often communities go weeks at a time without a medical physician, so you're doing a lot of phone consults with doctors down south or on-call doctors. So they rely on you a lot for accurate information as well as comprehensive patient care.